So what ethical principles are violated by the development of genetic testing? First of all, we have autonomy. It is very important to the Native Americans to be completely informed of what is being asked of them. All relevant information about a study needs to be provided to the tribal members. With genetic testing, they will want to know what is being tested, why it is being tested, and what will be done with the results. In this way, each member can be made informed so that they can decide whether or not to participate. Next is beneficence. The Native American tribes emphasize the maximum benefit for the maximum amount of people. There is concern for the individuals of the communities in regards to their physical health, mental health, spiritual health, and social health. Some feel that researchers have a moral obligation to beneficence. Another area of concern is fidelity. Native Americans already distrust people from other cultures because of things that have occurred to their ancestors. Abuses that have occurred in the past include misappropriation for sacred songs, stories, and artifacts, taking Native American knowledge as being primitive or superstitious, and they have experienced a violation of their community norms regarding the use of human tissue and remains. Justice refers to the obligation to treat all people fairly and equally. One must consider how to distribute the benefits and burdens equally amongst the tribal members. All members of the tribe must be able to have access to whatever benefit may come from the research. Justice may be compromised when an imbalance of power exists between the researchers and participants. Non-maleficence, which means do no harm. To Native cultures, any part of themselves is considered sacred, which includes the DNA. It is a part of the person, thereby making it of deep religious significance. They believe it is the responsibility of the sovereign nation to protect its people from harm. Many tribal members struggle with the debate of the good that may come from this research versus the harm that it may cause to their ancestors and their traditions. So what are the potential outcomes of genetic testing for Native American patients, the healthcare system, and providers? There are both benefits and negatives to consider with genetic testing. Some benefits include being able to detect potentially serious health conditions in its early stages, if not before. Once detected, a patient and the provider can personalize his or her care plan based on the genetic results. Knowing what your genetic tendency is towards developing certain diseases gives patients the opportunity to make lifestyle changes in order to prevent the development of the disease. Healthcare providers can monitor and plan treatment options tailored to the individual. In the long run, healthcare costs can be reduced by having less unnecessary testing done and reduces the need for follow-ups. Pharmacogenetic testing gives patients the information that they need regarding whether a certain medication will work for them or not. This helps providers order the medication that is right for the patient and makes it easier on the patient by not having to try all these medications before finding the right one. Some of the downfalls to having this knowledge can actually increase a patient's anxiety and worry as they wait for test results. If the results are bad, they debate on whether to tell other family members or to keep the test results silent and not upset them. Native Americans fear further discrimination, especially when it comes to testing for their heritage. Some companies use genetic research to test Native Americans who want to enroll in tribes by providing their bloodline. This can offend people who have deep beliefs in where their ancestors came from and do not want some DNA test to try and disprove it. Although by doing this testing with new members, it can eliminate any question of whether the person has tribal DNA or not. Another negative is that testing is not 100%. There has been false negative and false positive tests reported, which can add to the stress and anxiety that a person experiences. There are generally minimal risks involved with doing a DNA test. although the most significant being when they test an infant in the womb. This can increase the risk of miscarriage. Finally, there is a fear of losing insurance coverage if diagnosed with genes that lead to chronic disease. Because of this, the government put into effect the Genetic Information Non-Discrimination Act, otherwise called GINA, that makes it illegal for an insurance company to drop insurance coverage due to genetic testing.